Welcome to the Taking Care of Tutu podcast. I'm your host, Meg Ilbanoff, and today we're excited to have Tanya Barbero on the podcast. She is a nurse at Hospice Maui. Welcome, Tanya.
Good morning, everyone. Thanks, Meg.
So I would love to know about how long you've been a nurse, a little bit about your background, and what made you decide to work at hospice.
Well, first of all, I would like to say that working in healthcare for the last 40 years has really been an honor in my life. I'm not
40 years.
Yes,
Oh my
40
gosh.
years. Just doesn't look like it.
No, not at all.
I'm not a nurse by certification. I'm actually a registered medical assistant. And then I also
all these years I thought you were a nurse.
Yeah, well, I did do outpatient care at Maui Medical Group for many, many years. In fact, most of those 30 years or 40 years were there. But I started off as a medical assistant. I was encouraged to go into nursing school, but the funniest part of the story is that I was so afraid of taking care of patients who were dying. And so
that is very ironic.
Isn't it ironic? And so I never went into it, even after all of the encouragement from all of my my instructors. They kept saying, Tanya, go. And I says, no, I found my niche. What I wanted to do was to really be in relationship with patients and to help them to take care of themselves. And Maui Medical Group at that time provided me that wonderful space as well as experience. So while I was not trained or certified as a registered nurse, I worked under the tutelage of many great nurses and was able to fulfill a role that was very similar to it, and also to grow into other areas that allowed me to be able to get to this point now where here I am towards the end of my career, taking care of people, not who are living, but are going to be able to live the rest of their life out the best as they can. So that's the funny story about me. I came to work at Hospice Maui after retiring from Maui Medical Group because I faced a serious health condition myself. I was diagnosed with a rare bone cancer in my brain. But thankfully, everything is wonderful, and I am so far have been cancer-free since 2016, and
amazing.
Given an opportunity to work here at Hospice Maui as an outreach coordinator. So I go out.
Can I interrupt you for a second? You must feel that you having to face your own mortality is what made you want to help others do the same?
I would have to say that probably that was the gift of facing my mortality, was knowing that if I lived a good life, why can't I face the fact that I may be dying and to live it well? And hospice Maui really helped me to recognize that that is a gift and an opportunity that we should all consider.
I'd love to know how long Hospice Maui has been in existence. And will you tell me what are the services that you folks provide? How much do they cost, or how do people pay for them? And how do they find you? And that's like 4 different questions. So we can just kind of roll.
You'll remind me in case I
as long as I remember.
But what we do in with hospice is really it is an accompaniment. We don't want people to journey on this alone. So Hospice Maui actually was conceived, if that's the word you use, 43 years ago. We became Hospice Maui 43 years ago. But prior to that, maybe like 45 years ago, a group of women in our community heard Dr. Kübler-Ross at Seabury Hall in the very beginning. So this was in the early 80s about the whole concept of hospice care. And if you recall, this was during the time of the AIDS pandemic, and people were
wow.
having to be faced with these, difficult decisions at end of life, and
Earlier
and
than expected.
earlier than expected. And then there was that stigma. So it's much like what the mm, actually, this is really how it comes about is, hospice care, it comes with that same root, like hospitality, hospital, or caring for, right? And that's what
Yeah.
Mother Teresa did in taking care of the poor and the dying in Calcutta. And the hospice care is a part of that. If you want to think about how it is allowing people to die their natural death with dignity and with comfort. So these ladies from our community heard this and said, "Hey, we want it here on Maui." And so from that conception, they started working together as a group, and Hospice Maui started off as a volunteer organization, meeting the needs of our community at the ask of our community to care for people who are dying. And so that was all volunteer. There was one employee, Charlotte Kuanoe, who is a social worker. She kind of ran the thing, but there were other people who volunteered on their social workers, nurses from our community, registered nurses, volunteered time to take care of
That's
patients.
amazing.
And from then we grew to the organization we are now, with over 100 employees. And, and we're Medicare certified. So this is now how things get paid for. We are able to bill insurances because hospice care now has been seen as a service. It's medical care that can be provided. So here we have this long history of being an organization that came out of a request from our community to who we are today, still serving with that same value that everyone is cared for as part of this community. We say that we stand on the shoulders of many people from years before. And it's so important for us to carry that same value of caring for each individual as an individual, not cookie cutting anything, even though hospice benefits are required to be provided by federal standards. It's not so much what we do, but how we do it here at Hospice Maui. And we have grown as a nonprofit agency in this community, and very valued by our physicians and those that we serve.
I think that like palliative care is such a gap in our insurance coverage in the US and in our system. And I also think, I don't know how many physicians are really trained that much in palliative care because we have such a save
Yeah.
everybody
Yeah.
system.
Mhm.
Yeah.
And it's very
That's
true.
amazing.
It's very true what you say about that because, when one thinks about the physicians oath, it's to take care of people, to make sure that they stay healthy. Um, Sometimes that whole idea, it's like, and to do no harm. Sometimes there's that misconception that by doing that is either giving up or, I don't know. I think the conception of the public in general is once you say hospice, they say, oh, we're giving up hope. This is the end of
Yeah.
life. So I'd say that whenever a person or their family recognizes that, hey, you know what? Um, their natural end will be coming up sooner than later. Let's let's see how we can do this to help them while we're doing it. So any referral to hospice can be made online, either by your physician or people can make that referral themselves. We have it very easily done on our website. at hospicemaui.org, an area for referral. And what happens from then is we will take that call or that inquiry, and we'll follow up with it, with the doctors, with the family, and see what would be the best type of service that we can provide. You know, it doesn't hurt to ask. I always tell people when they call me or talk with me about it is that if you knew that you could be able to be giving your loved one, your mom, your dad, your grandma, your grandpa, even yourself, comfort to be able to have the best of the rest of your life, why not just give a call?